I'm Dr. Bivani, Health System Technical Officer at WHO Country Office, Iraq. I'm deeply honored and privileged to moderate this important session of Kurdistan Health Summit. We all know that the current pandemic of COVID-19 and also in the last decades how important health policy became globally. Because of the raising awareness that the public health status contribute to the socio-economic development. So as we hear today, we see the determination of the Kurdistan government to reform health care system in Kurdistan to meet the people's need and take the word to action to reforming the health system. We have here 4 distinguished, honorable panelists, experience in health system reform and development. I would like to call on them to introduce themselves. I will start with Dr. Rajab, please.
Thank you. Good morning, all of you. I'm very happy to be here with you at this very fruitful meeting. My name is Recep Aktal. I am a former Minister of Health and former Deputy Minister in Turkey, and I oversaw a great health transformation program in my term. Thank you.
Thank you, Dr. Your Excellency, Dr. Saman.
دكتور سامح حسين برزنزي وزير التندرستي حكومة هرم كردستان.
Where is Dr. Alan?
My name is Alan Dilani. I'm pleased to be here. I'm an architect and public scientist, and very honored to be in this committee because 80 years ago I met worked with the ministry and also designed Akdeniz University Hospital, now it's finished. Hospital, and very honored to be in this committee.
Thank you, Dr. Alan. Dr. Azad?
My name is Azad Najjar. I am a urologist, senior consultant in urology.
Thank you, Dr. Azad.
I am an inventor and researcher within the circulatory system.
Thank you very much for introducing yourself. As we said, we are here today for the 3 days to reform the health system, and we can see that there is over 40 sessions. Each of these sessions are a small component of the health system, part of this health system. I mean, for myself, I mean, when we talk health system, most of the time I forget, I think my name is health system, but it's not just me. I think everyone and each of you here attending today this session contribute to building this system. Whether you are a manager or you are a health provider or you are just a patient, you always think what we can do better to improve the system and the service delivery to meet the people's need. So to not take much of your time, the session, we have 1 hour left for this session. We will start with 2 presentations. First presentation by Dr. Alan Dilani and the second presentation by Dr. Rajab, followed by discussion with the distinguished panelists, and then we have 15 minutes for open question to ask the panelists. So, my colleagues, we all know that the way forward to move from words to action, it's a not easy task. The carry out of health system referendum is a challenging, and experience has showed us that's due to many reasons, whether it's a political or it's a practical issues. So Dr. Alan Dilani, the floor is yours. You have 10 minutes, please, for your presentation.
I have a few slides actually, but since I have several presentations today, I just slide before already. I just introduced myself, my background, what I am doing now. I am architect and I went to medical university. I did my PhD on public health. And later on I founded the Research Center for Design and Health and International Academy for Design and Health. And since that, in the last 30 years, I am advisor to several governments worldwide and have written 16 books, and my next book coming next month by Cambridge, dealing with health system through salutogenic and ecological design with Ken Young and several medical doctors. So this is International Academy Design and Health and several brands that I have developed worldwide. I work with several universities, among them Harvard University, Cornell University, Texas, and Singapore, Australia, China, Canada, many countries actually. I lectured in 70 countries and I visited 90 countries in the world in my last 30 years. I present always this slide. It's very important. These show 50 countries, healthiest country in the world. And these challenges of all ministers of health around the world, how to be among these 50 healthiest countries in the world. And what is the reason behind and why this country is healthiest. As we see, Italian is top of them, and then some other countries, you can see here the list. Italy, Iceland, Switzerland, Singapore, Australia, Spain, Japan, Sweden, where I live, and Israel, and etc. As we see this slide, the United States is number 34. United States spending 20% private funding healthcare, that's spending 20% of GDP, but still is number 34. Country like Singapore, that I work very closely with health minister who is engineer, not public health, not doctor, who is engineer. I visited many times and I work with the daughter of founder of Singapore, President Lee Kuan, and we develop a lot of work, and this country is spending only 4%. Public funding health system that looking how the causes of health, what make people healthy, not curing only diseases. And that is the importance of that slide that shows public funding health system spending a lot of money, but they are not good health. And what is the reason? Now I show. Italy. Italy's strongest economy has world's healthiest people. This slide shows clearly people sitting in this environment with the lifestyle in this beautiful plaza, no stress, daylight and sunny and good food and exercise, all this, the lifestyle. This is the main reason why they are healthy, not healthcare. And World Health Organization, the challenge of our government should be how we reduce non-communicable diseases is determined through the creation of health-promoting environment. This is World Health Organization mentioned. How to create an environment that really change our behavior for a healthy lifestyle that promote health. So this definition is, you know very well with that. Health is state of complete physical, psychological, and social well-being. 3 dimensions, not only physical. But health is a process I developed at Karolinska Institute with my colleague. It's composed of psychosocial factor, lifestyle, emotion, and experience will lead to health and life, and equally, diseases is a process. Psychosocial factor, lifestyle, emotion, and experience will lead to illness and death, but also biological factor. So the health of each of us is the matter of balance between these two processes. What is most important, if you exposure for risk factor, you might be in this side, and you exposure for wellness factor, you are always on that side. This is the best place, state of well-being. And these we call salutogenies, the other side we call pathogenies. The medical science focus too much here. We develop 8,000 diagnoses, the causes of diseases. If medical doctors, medical science focus equally on public health, we could develop 8,000 wellness factors. What make people healthy? And that is the creation of healthy society, which I am working for my last 30 years. So, myself, I am 65 years, almost. I have never used any drug, never hospitalized. The only things I do, every day I do gym. Every day I do gym, at least 3 days. I never smoke. I drink very little alcohol, glass of wine, and don't eat junk food. That's all. 3 things is make 50% of death in the world. These 3 things: smoke, lack of exercise, and junk food, McDonald's. So very simple. This is the public health. The built environment has tremendous impact of our emotional lifestyle. We have the college tell us, tell me where you live, I can tell you how long you live. So that is the theory of health that we have developed, and we are working on worldwide. And this is the same theory of stress. We have developed Karolinska Institute, that's built environment, create social organization, structure and function in our society, which leads psychosocial stimuli together with psychobiological program, develop a mechanism that we call stress, and finally to diseases itself. Even stress, like health, is a process. It's not happen in 1 second. Interaction with the environment, with people, our lifestyle. So, we have developed many PhDs. I have many PhDs worldwide that are working with me around this theory. And I'm showing this slide. This is the public funding government worldwide. They're spending almost 80% of their budget for non-communicable diseases. Heart diseases, cancer, digestive, obese, and diabetes. All of you can prevent that. This is not the task of the government, not the task of Ministry of Health. This is the task of society. How to prevent health, how to promote health, and how to prevent diseases. So, I work very closely with the government of Australia. This is the salutogenic hospital we developed. Based on my theory, they came to Karolinska Institute. We worked together. We went to Finland. I went many times, and I wrote this book to the government, to the Ministry of Health, and we applied. We changed the health system of Australia. I worked with 6 states in Australia, the workshop, and from the policy they have, healthcare, we changed. What are the causes of diseases? We change to health. What are the causes of health? Not what are the causes of diseases. This means a lot of complications for the government. They must change. This is the strategy. This is the vision. And then how to treat diseases, how to prevent diseases, we change to what contribute to good health. What make keeping good health easier. And that is the interdisciplinary. The health is not the task of the government, only Ministry of Health. The task of Ministry of Education, Ministry of Planning. So that is very important. Ministry of Health must work with Ministry of Education, with Ministry of Planning. We must educate our kids. It takes 20 years to change entire generation for healthy lifestyle. And then we don't. 1 minute. 1 minute I manage. Thank you. So this is very important. The Ministry of Health working with Ministry of Education and Ministry of Planning, interdisciplinary work together how to prevent diseases. I work very closely with Ministry of Health in South Africa, he's public health scientist. I was recently in May with them again and developed a lot of work in the hospital and competition. So why we should design clinic? Where his entire problem is obesity, lifestyle. I said we can have a school of obesity, educate health pilot, how we can create healthy society. That means instead of clinic, we design health promoting lifestyle center. We did exactly for Kurdistan because a lot of lifestyle related diseases here. Sugar is the main causes of diseases. Sugar in this country. Smoke, the second one. And car accident has been reduced, very good, but most of the causes of death is accident, lifestyle-related disease that has nothing to do with Ministry of Health. This is your task in the society. So, nowadays I am living in South France, I'm retired, and I do some consultancy and some book, and I design the most spectacular house. This recently I designed and I'm working and I read the book. And I write the book. And I will be very pleased to come back here often and work with you guys and develop change health policy. This was my last slide.
Thank you.
That's the chin.
Thank you very much, Dr. Alan Dilani, for highlighting the most important, one of the strategic direction of WHO on promoting healthy lifestyle. Thank you so much, Dr. Alan. Now the floor is for Dr. Rajab Agda.
Thank you.
You have 12 minutes, I think. Yeah, presentation.
والله بعطيني دكتور نادي.
Good morning again. First of all, I would like to congratulate the organizers with this very useful meeting. I know that all of us, we are learning a lot in that meeting. I am Recep Akta, former Minister of Health in Turkey, and I oversaw a great health transformation program between 2002 and 2013, and we call it Health Transformation Program in Turkey. Our health transformation program, acknowledged by many publications and international organizations, including Lancet, WHO, and it says that, the example of Turkey says that reforms in health sector transformation can be doable, even in a very short time. For this, purpose, we have to focus on health system goals, final goals, because all of the things we have been doing just to reach these final goals: improved health status, strong financial protection, and high citizen satisfaction with sustainability. We should focus on all of them together. And in order to reach these goals, we should reach some intermediate goals: efficiency, accessibility, and then we use some control nodes. That is the short story of any health system, any health transformation. Of course, healthcare is a fundamental right. In the previous presentation, we realized that, being a rich country does not give you always success for healthcare system. So, for instance, in the United States, some people think that health is a good like food. You have to purchase it. I strongly believe that health is a fundamental human right. Universal health coverage should be accomplished by all the countries. So I'm gonna show some short results from our journey. Maternal mortality rate in Turkey during our health transformation program decreased very sharply. Life expectancy at birth increased again very fast. And in an article published in Lancet in 2017 showed that Turkey is located at the top 5 countries in terms of healthcare access and quality index. And satisfaction rate increased very, sharp way, from 39% to almost 75% within the 10 years of time. Okay, the satisfaction rate is very high in Turkey after our health transformation program. But what is the situation of health spending? You see that, my colleagues, Turkey has a unique position in terms of spending and satisfaction. It is very important. It is the same for life expectancy at birth. This slide always is very important for me, and I know that many countries ignore to measure these figures. Catastrophic health expenditure means any family if any family spent more than 40% of their disposable incomes, it means that they have catastrophic health expenditures. It was 81 in 10,000 in Turkey before our health transformation. At the end of our health transformation, it dropped to 14. It is very important because it is an equity issue. If we want to establish a good working system in our countries, we have to focus on equity as well. So before our health transformation program, our system was very fragmented and inefficient. We had an underachieving health system, and we had, very strong red tape. I always show this piece of paper in my presentations, and then I took that piece of paper in my wallet because it reminded me what we had in Turkey. It has given me in front of one hospital before our health transformation. It just showed us what kind of document you need to reimburse just 10%, $10 from your social insurance for blood glucose fix. You have to collect invoice and 3 copies. You have to collect your recipes and 3 copies. Your identity card, blah, blah. It was very difficult task. Now it is very easy. You can go to the pharmacy and then you can get whatever you need. I realized that we have some common reasons for inefficiency and inequity. In many countries, especially in our region, presence of dual practice, working private and public, scarcity of healthcare staff and uncontrolled recruitment of the human resources by private sector, imbalanced distribution of resources, different and unfair benefit packages, and insufficiency of public funds. So what we did in Turkey, we used a two-pronged approach. At the very early beginning, you have to have some quick wins, some low-hanging fruits, just to continue your effort to finish your transformation. It was my first decree in my office. It says that no hostages in the hospitals anymore. Unfortunately, we had very bad behavior before our health transformation program. Patients, sometimes diseased newborns, had been kept in hospitals, provided that the family paid the money. It was my decree, so it increased the trust in the public, and then it is a kind of public support as a shield. So I believe that any transformation effort should be comprehensive one, focusing on implementation, because almost all parts of the health systems are closely linked to each other. Looking at just one part of the system probably will lead you a failure. So it's very important. It is not easy. I know difficult task. Dealing with whole system, whole part of the system. But I believe that there is no way. I expand in many countries struggling with the reforms, and then at the end of the day, failure. The reason generally is to focus on just part of the system. I'm not going into details of our transformation because the time is limited, but we established a national social insurance, we balanced public-private mix, we established our family medicine system, we improved our emergency transport, We strengthened our public hospitals. We employed new information systems, and we have been using public-private partnership, very common in our country. So holding the budget gap is very important for all the health ministers. And we health ministers always want to increase available funds. Yes, it is possible, but sometimes it is difficult, you know. So it is very important to reduce healthcare needs by improving health literacy, promoting healthy lifestyles, adequate prevention, and of course we need to control costs. And I never recommend cutting services to control cost, because then you can lose the trust of the people, and then again you will fail. You can use high efficiency and public-private balance, HR allocation principles, new job definitions, full-time policy, pay for performance, PPP, of course, clinical intelligence and strategic purchasing. They are, I mean, the tools for a successful health transformation program. So I believe that we can't say, we never say laissez-faire for the health issue. Because as I expressed before, it is a fundamental human right. So it is necessary to end dual practice and ensure effective control of the private sector, especially for recruitment. In Turkey, health service distribution, is health care, especially in hospitals and primary health care, is given by public almost 84% in 2002. And I believe that it is the right time to make a real health transformation in KRI, because I believe that from the top level, from Prime Minister to the all levels, the people will is very high, receptivity of change is very high. So I say that it is the exact time to make a real changes, a real health transformation program in KRI. Thank you very much.
Thank you.
Thank you very much, Excellency Dr. Rajab, for your insightful presentation about the health transformation program of Turkey. And we know that you have started the process, and this is an opportunity to learn the know-how from you. So my first question to His Excellency Dr. Saman Barzanji. Yesterday you mentioned a very important point in your opening session. You said that our system needs to be reformed. You said that our system is old-fashioned, and the socio-economic development and the increasing awareness of public health importance in the world requires us to act and move forward with reforming the system. بالنسبة لجنابك, a successful health transformation, how does it look like to you? شلون health system transformation بلانتو شلون نجاحتها يعني و how to achieve it يعني شلون رسلي بهني حزكي بكردي والله مديته بإنجليزي فرمو
زور سپاس يعني كان باش سپاس بو آمده بوان بو برزا ناو پانیلکا سپاس لبو او presentation برزا ناوی كاكتور اعلان و دكتور وزا دیارە پرسیارەکەی بەڕێزت پەیوەندی بە بابەتێکی دوێنێکە کە باسمان کرد گوتمان سیستەمی تەندروستی ئێمە سیستەمەکی کۆنا و گونجاندنی ئەو سیستەمە لەگەڵ داواکاری و پێداویستی مجتەمەعی ئێستا بۆتە ئەرکەکی قورس ئەگەر بمانێ هەمان سیستەم بە هەمان پێداویستیەکە لە بەردەستێتی بە هەمان ئەو مەتریەڵە بیگونجێنین لەگەڵ ئێستای سیستەمی یان داواکاری یان بمانێت ساتسفاکشنی هاوڵاتی یان وازیبوونی هاوڵاتیدا قورسە لەبەرەوەی دنیا گۆڕایە لەبەرەوەی تێگەیشتن گۆڕایە بنەی تەحتی تەندروستی لە زۆر وڵاتانی دنیا دەیان ساڵەی ئەخیری دەتوانین بڵێن گۆڕایە مۆدێلی کارکردن گۆڕایە سیستەمی پسپۆڕی و سەرچاوە مرۆییەکان گۆڕایە و لە هەمووشی گرنگتر بەڕێوەبردننی تەندروستیش سیاسەتی بەڕێوەبردننی تەندروستیش گۆڕایە ئەو سیاسەتە سۆشیەڵە بە تەواوەتی نەمایە هاوڵاتی تێدا بە تەواوەتی لە پێداویستەکانی لە ڕووی خۆپارێزی لە ڕووی چارەسەری لە هەموو ئەوانەی کە لە ماوەی تەمەنیدا کە تەنها حکومەت تێدا بەرپرس بوو دەمێنێتە سەرەوەی هاوڵاتی خۆی دەبێت بەرپرس بوو هاوڵاتی ئەوەی وشەیەکی ئەخیری کاکتۆرالان شکەی باسی کرد کە تەندروستی هاوڵاتی تەنها لەسەر وەزارەتی تەندروستی و حکومەت نییە لەسەر هاوڵاتی خودی خۆتی ئینجاتە ئەنی دیکەی ناو کۆمەلگا بەرپرسن و ئەمە لە تەجروبەی کۆڕۆنا بینیتان بەبێ هاوکاریکردن و بەبێ تەعاونکردنی هەموو لایەنەکانی ناو کۆمەلگا بەما حکومی و غیرە حکومی و هەموو لایەنەکان بەیەکەوە نەدەتوانرا سەرکەوتن بەسەر یانزاڵبوون بەسەر ئەو نەخۆشیەدا بکرد لەبەرەوە پێویستی بە گۆڕانکاری هەیە پێویستی بە چاکسازیە و مانایوانیە ئەو سیستەمەی ئێستا هەیە بە تەواوەتی شەڕ بکەی و قەلب بکەی و دکتۆر پرۆفسۆر ڕەجەب ئەمە زۆر دادانیشتنی باسەوە دەکات کە ترانسفۆرمینگی پێ دەڵێت یعنی لە مەرحەلەی دەتوانین بڵێن ئینتقالی ئەو چاکسازی لە سیستەمی تەندروستی پێویستە احتیمالە بەشێک لە سیستەمەکەی خۆت زۆر باش بیت بیهێڵیەوە بە قوتی بکەیت و بەشێک لە ناوانە پێویستی بە چاکسازیکردن بی لە مۆدێلێک بیگۆڕی بۆ مۆدێلش تەمان سەرکەوتن لەسەر ئەو پرۆسەیە بەڕێزت پرسیاری وەت کرد کێشەکان چییە
چۆن بەدەستی بهێنین
چۆنیش بەدەستی بهێنین کێشەی تێدا هەیە چونکە کێشەکان کێشەی کەڵەکە بووە کێشەیە ڕەوانەیە ئەمە ئەگەر باسی خۆمەڵگەداری کوردستان بەدەستی بە سیستەمێکی ئەو سیستەمە چۆن هاتووە هەر ئەوە هاتووە دوورە لە زۆر ڕەهەندی نوێی دنیا کە پێویستی بەوێ بیگونجێنی دەبێت چارەسەریەکان بێکەوە بە هاوتەریبی بێکەوە ئەو چارەسەریانە پێکەوە دەست پێ بکەین بەڵام لەگەڵ ئەوەشدا وەکو جنابی پرۆفسۆر ڕەجەب تازە لە پرزێنتێشنەکە هەندێک ئەکشنی سەریع و خێرا هەیە دەکرێت کە ئەولەویەت بی طبعا سیستەمی تێگەیشتنی هاوڵاتی و سیستەمی بیمەی تەندروستی کە لە وڵاتی ئێمە بەداخەوە ئەوە بە وای من باشترین ڕێگایە پێشەم شتێک بتوانین ئەو ئامانجەمان کە توێنێژ من باسم کرد ئامانجی کابینەی حکومەت هێرشی کوردستانە هاوسەنگی دابینکردنی خزمەتگوزاری بۆ هاوڵات ئەو کە لە تازە باسی کرد universal health coverage وەکو یەکسانی کۆمەڵایەتیشەوە ئەو پێ نابێت هاوڵاتی هاوڵاتێکی کەم دەرامەت و فەقیر لەگەڵ هاوڵاتێکی خاوەن ئیمکانیەت بی کە جیاوازی هەبێت ئەمە کاری ئێمە بە بڕوای من سیستەمی بیمەی تەندروستی تەمینی صەحی اینجا تەفسیل بیمەی تەندروستی مۆدێلی زۆر تێدا هەیە شێوازی زۆر تێدا هەیە لە ڕووی پرایڤێت لە ڕووی حکومی و ئەمە تەفسیلێکی زۆرە ڕەنگە سەعات بێ ئەگەر باسی بیمەی تەندروستی بەڵام بیمەی تەندروستی یەکسانیەکی کۆمەڵایەتی دروست دەکات عەدالەتێکی اجتیماعی و خۆی لە خۆیدا کۆنتڕۆڵکردنی سیستەمی کوالیتی دەکات بیمەی تەندروستی سیستەمەکە خۆی دەبێتە مراقب لەسەر خزمەتگوزاریەکان لەسەر مؤسساتی صەحی اینجا حکومی یانیش پرایڤێت کردی تایبەت بێ لەبەرەوەی کوالیتیەکەش بەرز دەکاتەوە لە هەمان کاتژدا مسۆگەری خەدەماتێکی باش دەکات لەبەرەوەی هاوڵاتی دڵنیا دەبێت لەوەی کە ئەگەر بێت و پێویستی بە پێداویستێکی تەندروستی بوو لە بۆ چارەسەری ئەوە لە ڕێگەی سیستەمێکدا کە خۆی تێدا بەشدارە دەتوانێت ئەمە یەکێک لە طبعا ئەوەش فاکتەری سەرکەوتنی و سیستەمەش زۆر گرنگە سیستەمەکە بەردەست نەبێت بە شێوازی نەزەری سیستەمەکە حاضر بێ بەس بڕیارێکی بێت نەخێر سیستەمی بیمەی تەندروستیش چالەنجی خۆی هەیە و سیستەمی بانقی پێویستە و سیستەمی داتا و زانیاریی پێویستە و بەدەستهێنانی سەرچاوەکانی دارایی یان سەرچاوەکانی داهات و بودجەی ئەم سیستەمی پێویستە ئەمە تەفسیرەکە شێژەکە
The second one with Dr. Zorzor Mamnuntin. Thank you, Your Excellency, for sharing with us what success is to you for reforming health system and the way forward for it and what can we do. Now, I have my two experts, Dr. Alan Dilani and Dr. Azad. My question is addressed to both of you. I mean, from your experience, you have worked in the Kurdistan region, you have been in Kurdistan region, and you have seen many other systems outside in the globally. So my question is from your point of view, your perspective, is what are the major challenges is facing the current health system in Kurdistan, or the health reform in Kurdistan, and what are the priorities for the reforming? So, two questions. First, Dr. Alan Dilani.
Well, I leave to him because he has not spoken yet.
Yes.
Yeah.
Dr. Azad.
Before going to the priorities and going to the challenges, so we need to really focus on the processes in making reforms in Kurdistan. I mean, with the processes, how to create a possibility to have a good monitoring on the system, and to have to enhance the research, to strengthen the evidence-based knowledge to be applicable on the health system, and even to create a condition that make all these things to be in the health system to be sustainable and to be work in a good way, like to be to have high quality, to be equity, etc., that Dr. Rajab mentioned. So the monitoring of the system is good, which means that you need to have a control over the private sector, as Dr. Rajab mentioned, what they did in Turkey, to ensure that a high quality in this sector, as well as to push them to do the good things. For example, to make a processes in this kind of direction, that, for example, to creating expert group in Kurdistan, that they will be the expert that will come with guidelines that all the other doctors in Kurdistan, they can follow these guidelines to ensure that these guys, that the health sector will react according to be updated and to work accordingly to the sustainable system to make the health to be promoted in Kurdistan. So we need to create policies, we need to create strategies, rather than to concern or to focus on the contents. We can mention a lot of minor things that should be changed. I don't say that we not change them, but to create a rules, policies, strategies, how to make these changes be possible and how to monitor the changes in the future to be sure that there is nothing wrong to be happen. So it's not, the health system is not perfect, as Mr. Saman mentioned. It's an old system and really need to be changed.
Thank you very much, Dr. Azad. You clearly highlighting the importance of plans not to be static, plans to be evolving as the system evolves and the needs evolve in process manner, what we call it strategic planning and process. So thank you so much. Dr. Alan Dilan, is the same question to you, but I add one more, because you highlighted importance of role players. So the question to you is, and they are, what are the major challenges in your point of view? What priorities to be addressed in reforming the system? And the third one, who you think are the main role players in Kurdistan?
Yeah. My last book, Building for Health, is my last year, 30 years experience worldwide, at least with 40 ministers of health around the world, and closely working with I must say, 15 ministers around the world, entire. And the most challenges of each country is different. We have budgets, and the Ministry of Health, we must dedicate how much, how many percent could be related to treatment, could be related to rehabilitation, and could be related to health promotion. Now, we have looked at this budget and the reality, we have screened some data about the causes of death. We have found that the majority is lifestyle-related diseases, as World Health Organization mentioned. But the budget for non-communicable diseases, lifestyle-related diseases, is only 2%. Smoking is dangerous. They budget $1 million just how to reduce smoking. This is not efficient. And almost over 80% the budget related to medical treatment. Why I call this is Minister of Medical Treatment, not Minister of Health. من كردستان نتسان صالو وزيري نخوشي من هي نوزير تدرسي سنات كان السلام وتي بوق صار دلي وتم بداخل آوايا إما لزيات أويك نخوشي شيء ويجان درمان كين صار السليب كين كلولا إما شكرو سيغارو شيء ويجانا هشتاق ده سليم لولا شيء ويجانا سبكة بوها أول زور جرينجا دير دا بياخي بيردا أوي كتشون بعد جاي وزارة تدرسي لسر نان كومونيكابل أو جولة تشالنج جولة هاندانا بو هم وزير كاني زور داي أنا لو لاتان لو قطر كان لو لاتان تركيا لقى جنابي I work with Excellency Minister 18 years ago. The first meeting I had with him, I asked. The causes, major causes of that in Turkey is smoke. Because in Italy we say, fumi come un turco. That means you smoke like a Turk. This is not good. We must deal with that. And His Excellency did that. Very successfully. And next time I met him, he said, all restaurants, they are very successful because we have stopped smoking. Now the people, they bring also their children to restaurant. They have very good business. Now they ask us how to open permission one room for smoking people. So that means actually we must start with more challenging. And the second is car accident. Now in this country we have much improved actually. So that is my major
Priorities.
priority.
Thank you. Now, who you think are the main role players in this reform? To reform the shifting strategies from curative to preventive. Who you think are the main role players?
Well, it's not only the Minister of Health, really. This is, I mentioned at the U.S. Academy of Science with Julio Friend, we were together at Harvard. We mentioned actually that we must emphasize on non-communicable diseases, and this is the major task. This we must have created a incentive for the private sector to do business on health, not in diseases. And really, in this country, we can create a lot of jobs. How to support people, clinical that screen people that check up small diseases in early stage in our life. Screening is the major task for the country, like here, like Qatar. I was in Qatar, the same issue. Diabetes is 50% of causes of death. We know in this country we have diabetes as well. So, in Austria, 3 years ago, they reduced the use of salt in restaurants with 30 tons. And what happened? Hypertension came down. So it's very simple. In Denmark, we know that every Saturday, Friday, the kids, they wanted chocolate. So this is the culture. So they reduced the use of sweet. So obesity among children came down. We must see the causes. Every country has own specialty. Every country is different.
Thank you.
So we must focus on the country and find their own solution. Global perspective, knowledge, local identity. We must learn from other countries. We bring and apply according to our culture.
Thank you, Dr. Adam, to bringing up the importance of contextualizing plans and processes. Thank you. Last question goes to Excellency Dr. Rajab Aghdar. 5 minutes, and then we move to open questions. Dr. Rajab, you have carried out all the health transformation program in Turkey, and you have extensive knowledge of Kurdistan, and you visited Kurdistan many times. You did an assessment in 2015, and you presented a proposal for transforming the health system. And we know in Iraq, post-2003, many initiatives has been, and there is a vision, there is a commitment from the government. From the know-how of your experience, what do you see as a priority issues, and how do we achieve this transformation? And then the second question is, reforming Kurdistan health system, can it be done independent of Iraq?
Yeah, let me start from the second question. I believe that, of course, the transformation in the KRA should be done together with Iraq, because I mean there are many links in terms of administration, in terms of legislation, in terms of resources. But of course, in the region, you can change lots of things, independently at the same time. What is the most important thing for the reform? I believe that, I should repeat it. I believe that it should be a holistic one. I'm a pediatrician, and I always focused to decrease the risk factors for NCDs and the other things. For instance, the tobacco control measures in Turkey is one of the top in the world during our term, and then WHO gave me a special award for that reason. But I know that we can't separate any part of the system. Let me give an example. We are in the middle of a pandemic, and there are some patients, needs intensive care unit. It is, tertiary level, the three necessity. So we can we say that Mr. Minister can say that I'm not responsible for that? It's not possible. So it should be a holistic approach. We should strengthen our hospital, public hospitals, we should strengthen our emergency transport system, as well as promoting the people for healthy lifestyles, and putting the prevention measures no other way. Even for the lifestyles, as Minister of Health, as government, you can't say that we are not responsible for your health. You have to live healthy. It is not our responsibility. As a politician, you can't say such kind of words. So the approach should be holistic. I know that it is not easy. It is a difficult task, but I believe that there is no way. I gave at least, consultancy at least in 20 countries, 25 countries, and then I couldn't see any other way. And it is very important to set up a citizen-oriented health system and caring equity, protecting poor people, middle-income people. If you are a rich family, you can find a way to get the necessary treatment for your family members. As a ministers, as a prime ministers, as a governments, we have to keep the right of the poor people and middle-income people.
Thank you, Dr. Rajab, for highlighting the importance of health as a responsibility of all, and health system reform needs a holistic approach, taking into consideration the service availability, protecting people, and promoting healthy lives, and also saving people from emergency. So we go to the last part of our session. We now open the floor for questions from the audience. Can someone help with the mic, please? Dr. Sirwan? Yes. Who are these people?
Thank you. I am Dr. Sirwan,
Yes.
Health Director in Germian. I am sold in that office for more than 6 years. I have really two questions, one for Professor Alan and one for Professor Rajab. Professor Alan, you mentioned the lifestyle is it's a work that we can do before transforming the health and providing the health care, good health care for people. You know about Kurdistan, we are not a wealthier nation. Many of the citizens, many of the families, they are not have good housing, they have not access to the basic needs of life here. You just don't, you have to visit the other cities, the small town outside the capital, just every. There is a huge gap between those major family outside the capital and other cities. And according to the statistics of the Ministry of Plan of Iraq and also Kurdistan, there is a lot of unemployment which is common among young family. We have 3 million IDP, internal displaced population inside. Do you think you have an alternative for situation like Kurdistan to go through that planning and make a better lifestyle? And second question for Professor Rajab, is I think Dr. Amal asked you, but I asked again. Transforming the health in Kurdistan government region, you know we are inside the Iraq and you have a constitution which we still admitted to it, and that constitution provides that the health should be free for everybody. And I wondering, how could you do transforming the health system, changing the policies, the budget, everything about the health systems that provide a proper health for that region? And one of the main problem, you know, is the budget. Hardly without the government of Iraq, without our share in budget that came from Baghdad, we hardly can afford to pay our employment regarding the doctor, regarding the nurse for now. And our share in our Kurdistan region of government regarding the budget for health, it's very, very little. Major budget is going to other sectors other than. So in this situation, regarding the budget, regarding the political situation, regarding our constitution, from where you want to start to transform and change that sector? And thank you.
Thank you, Dr. Sirwan. Who wants to go for Dr. Alan? We have only 10 minutes, so if you don't mind, be precise and short, then we have time in the coffee break or outside to discuss more.
I must be very quick answer, and Dr. Rajab mentioned very clearly, health equity is very important. And one of the major I am working also with sociologists, how health look like among these people. And I work also in South Africa. I see rural area and township health is equally like in Kurdistan outside. It's very bad. But according to World Health Organization as well, recommendation, this is the task of government to provide clean land, clean water, clean earth. This is the fundamental for our health. Clean water, clean land, clean air. This is a fundamental for our health. And it's nothing to do with the Ministry of Health again. So in this area, we must provide the basic fundamental health for them, and also have a budget, have a screening people, see the causes of how we can improve it with minimal resources, the best outcome. This is always about the resources and outcome. We must work together, interdisciplinary, to find out how with the less resources, the best outcome in this region. We did the same in South Africa, and it's equal here, actually.
Thank you, Dr. Alan. Thank you.
Okay.
Yes.
Thank you very much for this excellent question. I believe that we have always, huge opportunities to increase efficiency in any place, in any context. I don't say that the budgets are not important. Of course, budgets are very important. We should increase our budgets as much as possible, but increasing efficiency is a kind of increase in budget in other way, in other words. Let me give an example. I'm a pediatrician. Let's say that we are pediatricians in a hospital, let's say 15 pediatricians, and we have only 2 outpatient rooms in our setting. If you increase your outpatient rooms up to 10, your efficiency in your outpatient clinics increase at least 5 times. But you're right. For instance, I don't know your constitution, your laws. We can put some syntaxes, we can use some co-payments without giving the hardship to poor people, protecting them. We can, implement some supportive insurance models and something more. At the beginning, it is very important to increase efficiency. And then I know that Mr. Minister and his team, they has already, trying to increase the efficiency.
Thank you, Dr. Rajab. We have 6 minutes, and I have 6 questions. 6 people want to ask questions. So if you allow me to save the time and let the panelists listen to your question, so I will write down your questions. Yes, because they are important. Dr. Dolivan, please. We will write the questions and then try to answer. If we managed, we will answer here. If we didn't manage, then in the coffee break. At least we know your concerns. So,
okay, thank you very much. Really, it's my speech is it's rather a comment rather than a question. Okay. I just noticed from the presentation of Professor Dr. Alani that from one slide is that it is talking about the healthiest countries. So we in our society, usually we mostly concentrated on the treatment-wise health, and mostly we are concentrating on the hospitals and the services that are provided in the health. But I do agree with him totally that we have to start from the scratch, from the schools, from the families, to build healthier peoples at first, and then from the treatment-wise, from the hospital-wise, we have to concentrate mostly on the health insurance, because the health insurance will will solve all the problems because we all know that the hospitals, the health needs budget. So if we concentrate now we compare the private and public sector services. The private one, because they have budget, they can provide the services that they would like to. In the public sector, Usually there is budget, but it's not sufficient. We have to concentrate on the public-private partnership, and also health insurance will make problem solving of all the problems.
Thank you. Thank you, Dr. Diloban, for highlighting priorities. Dr. Nizar Asmat, former Director General of DHOC. Mike.
Thank you very much for the distinguished panelists. Thanks, Dr. Amr. Actually, I have 4 questions, but I will only ask 1 question.
Okay, thank you.
And the question is to Professor Rajab. Can you tell us what was the resistance to change? Who was the resisting from the community, and also the factors, resisting factors?
Good question.
Thank you.
Very good question. Thank you very much. I can say that we didn't any resistance from the public, because almost all the policies we had implemented was in favor of public. But you can imagine that, and in dual practice, it was a difficult task. We saw some resistance from the specialists work in public and private, but we overcome that problem, giving some performance-based payments to the physicians, provided that they give up their private practices. The other resistance, unfortunately, come from some medical universities, because the number of physicians in our country is still low compared to some other countries. And then at that time, they were saying that the physician number is more than enough in our Turkey, but it was not the reality. Of course, for instance, we established a trace and tracking system for drugs. At the beginning, the industry, the pharmacists, the wholesalers, companies, they resisted. But now, they are praying for us, because it helped all of the system, put in such kind of system. The important thing is, wherever you see a resistance, the most powerful solution measure is dialogue.
Thank you.
You should always be open for dialogue.
Thank you, Doctor. We will take 2 more questions. Sorry for limited time. Yes, please.
I have one statement only. 2010, we bring Health Virgin for first time to South Africa, working with insurance. This is very important. They had 150,000 kids in their system after 2 years. Let poor people insured by government. Rich people, they can buy themselves. Each 3 years, they promote their health. They had gym for them. These kids, they will never be obese. They will be healthy. And in this country, we must incentivize, create a business for people to create insurance. Insurance of health, not diseases, to keep them healthy. And based on this, government can also incentivize and pay. We have 2 systems in Israel and 2 systems in Singapore, equally the same. Khalid and Rombach in Israel, and Think Health and Alexandra in Singapore. They compete each other. They belong to government, but they compete each other for the quality to keep them people healthy. We must learn from those countries. We must learn from those countries, bring here the same system that bring incentivize private sector to insurance people for healthy lifestyles behavior, screening people to avoid diseases. This is the most profitable business. I suggest also in the United States, we must do that. We must do that. We must incentivize, keep people healthy. This is the best health system.
Thank you, Dr. Adam. Actually, Mike? It's working. Our time is up, but I will take 2 more questions. If we can answer it, it's okay. Dr. Nasik and Dr. Haider, you are both sitting together. So I will take 1 question from Dr. Nasik and then Dr. Fattah. Sorry, Dr. Aso. I apologize.
بەڕێزان ئەوەی کە زۆر گرنگە لە کوردستانە ئەم بابەتی پرایڤەتایزیشن بووە بە بەزوەرد هەموو کاسێ باسی پرایڤەتایزیشنەکە اینجا پرۆی هەیە کۆنی هەیە مەسەلەن بەداخەوە ئێمە چەمکێکە بە ئیستفادەی لێ ناکەین و دراسەمان لەسەر نەکردووە ئەم بابەتی پرایڤەتایزیشنە کەمترین خەڵکی با بڵێن ئەوانی کە لە زانست هەروێرن قسەیان لەسەر کردووە مەسەلەی پرایڤەتایزیشن تایبەتمەندێتێکی زۆری هەیە بە مەسەلەی هێڵس فاینانشەڵ سیستمەوە هێڵس فاینانشەڵ سیستم ئێمە هەر نازانین ترانسپارەنسی نییە لە هێڵس فاینانشەڵ سیستمی ئێمەیە نازانین بودجەمان چەنە نازانین چەنی بۆ کێو ئەڕوا لە پاڵ ئەمەیە چەندێکی تر هەیە کە بەجددی ئێمە ئەوانەی لە کەرتی تەندروستی ئیشەکەینە بێ بەجددی بوێرانە ئیشی لەسەرکەین ئەویش چەندی کۆنفلکت ئۆف ئینترێستە ئەو بابەتەی کە پێوترێ پرایڤەتایزیشن سخناخە بە مەسەلەی کۆنفلکت ئۆف ئینترێست کێ پرایڤەتایزیشنەکە ئەیە ئێمە وەکو حکوومەت توانیومانە گایدلاین و پرۆتۆکۆڵات و مەسەن پۆلیسی خۆمان هەبێت دواتر لە بابەتی پرایڤەتایزیشنە مەسەلەن ئێمە ئیشراف بکەین یا ئەوان ئیشرافی ئێماکەن بەداخەوە خەڵک ماندووە بەدەست سەکتەری نەک تەنها تەندروستی هەر ئەپرۆچێکی عام هەیە لە کوردستانە بەرەو پرایڤەتایزیشن بۆ پەبلیک سێرڤیسز هیوادارم ئەمە بە وردی ئیشی لەسەر کرێ زۆر سپاس
دکتۆر فتاح مایک مایکەکە تەوە باشترە
نه مایکی نه
دەستان خۆش بە دکتۆر ئالانی یەک پرسیارم هەیە ئێمە یەک کۆلێژی تاقانەمان نەبوو لە کورسانە بە ناوی پەبلیک هێڵس لە سلێمانی بەرەو داخرانە ڕوا جەنابەت وەکو خەبیرە لە بواری هێڵس سیستەم وەکو خەبیرێکی ئەکادیمیش تا چەند بە ضرورەتی ئەزانی بۆ ڕفۆرمکردنی کەرتی تەندروستی پێویستمان بە کۆلێژی پەبلیک هێڵسێ لە کوردستانە
Well, Dr. Rajab knows those countries that are successful, those universities, like Harvard University, public health is number 1. Public health is all those medical universities, they are highest priority. And that is the lack in this country. We have no public health education. This is we have, in Netherlands, I have participated in many curriculum, I developed curriculum. We have healthy society faculty. In this country, we need healthy society faculty. I am with several universities. I am engaging now to develop master program on healthy society. This is very important. The time has changed. The global pandemic has a lot of opportunity for us to educate people to deal with health, actually. And public health is the major importance for our countries.
Thank you. Thank you all for your time. Actually, we ran out of time. We don't have time. Sorry. But last but not least, to move the war to action, we need a holistic approach in reforming the health system. And believe me, the private sector is a major participant and have a big role because they are existing. They are part of the system. They cannot be ignored at all. So thank you all for your time, and we look forward to see you in the next sessions. Thank you. Thank you all.